So what's the main reason behind this strike today?
Well, the main reason for the strike is that in the bargaining that we've had over the last number of months, we've had a number of offers from Health New Zealand for pay increase, all of which, unfortunately, have been substantially below inflation. What that means is that this is a real terms pay cut for doctors and dentists, and we feel that's not right. All the members who voted for strike feel that's not right as well. So we feel we've been pushed into this position by an series of inadequate pay offers.
It's a real difficult job, what you guys do. And my sister's a nurse in ICU, so I can speak personally of hearing what it can be like on the wards when you've got your feet on the ground. So how long have these issues been building up? And do you think that fatigue is huge for medical staff?
So short answer, a long time, and yes. A bit more detailed answer. I mean, I've been an SMO in New Zealand for nigh on 20 years, and from the time I came here, there was talk from doctors and dentists about understaffing, and what this really relates to is chronic understaffing of the medical and dental workforce, as well as nurses, physios, anaesthetic techs. It's across the thing. I think the problem over those 20 years is that despite us signalling this time and time again, there has never been any meaningful workforce plan to address this problem. The problem persists. We've had previous government ministers who have acknowledged there is a workforce crisis, and yet we're still in the position of being significantly understaffed. But the other thing that is looking forward, so the World Health Organization, probably about 5 or 6 years ago, published data estimating that by 2030, so what's that, 5 years' time, globally there'll be 18 million health workers short. There'll be a shortfall of 18 million.
Wow.
So this is affecting countries all over the world. So we really need, ASMS feels that we really need to get our house in order about how we recruit, because 5 years is not long. We don't have plans for improving recruitment. And as I'm sure your listeners are aware, if people are looking to come to New Zealand to work as dentists, nurses, doctors, whatever, if you're moving from Europe, there's another big country not far to the west of us who, for their own economic reasons, can pay a lot more. And if you're going to move your family, 15,000 Ks around the world, you're going to go to Australia, where you're going to earn more money than here. So we're in a difficult fight industrially in terms of the pay. That has to change. And that's what we want to see change. That's what's been building up. That's what's pushed us to this point now.
All right. So what changes in particular are you looking for?
Well, so the bargaining is around terms and conditions. And so we want terms and conditions, and we've proposed many that will improve our ability to recruit and retain senior dentists and doctors. And exactly what those are, all of us can have different views on that, but we want something that is robust and meaningful that will actually improve that. So, specific change, we think paying more is going to be part of that, but certainly not having a real terms pay cut. I mean, our view would be that nobody, public, private sector, should experience a loss in wages in real terms.
Yeah, and this is a little bit off topic, but perhaps topical in that AI is forever in the news. Do you think that there is a risk that AI could take some of these job shortages, or do you think it's really good to encourage young people to start looking at training as a medical salaried specialist to go into this field?
So look, I'm not an AI specialist. My view would be like a lot of things that we see. Someone says AI, it's the greatest thing since sliced bread, but there's a lot of devil in the detail. So at the moment, AI, I think, is capable of doing transcription for meetings and conversations. But when you get into more sophisticated stuff of hearing your history, your symptoms, and then trying to work it out what's going on, AI certainly, the ones I'm aware of, is a long way from that. There are problems of what's called hallucination. So sometimes it will invent things that haven't actually been said or heard and things. So yeah, in the long run, I'm going to guess, I'm 62, I'm going to guess probably not in my lifetime, or certainly not in my professional lifetime, it's going to make a difference. So yeah, people should be looking to go into health. It's a rewarding job in sense of what you can do to help people. It's going back to your previous question, it's fatiguing and frustrating in terms of when you have one hand tied behind your back because of resourcing. And you know, I'm a big proponent of the public sector, so I think working in anything in the public sector, teaching, emergency services, whatever, that brings its own reward of being part of a community and supporting.
What kind of a toll does this take on you personally? It's not the kind of thing you ever want to do as a medical professional. So is it hard on people emotionally right now?
Yeah, I mean, look, I think all doctors, their primary duty, their primary loyalty is to their patients. I hate to say this on air, but my primary duty is not, my loyalty is not to my employer. It's not to Health New Zealand. It's not to the government. My kids would probably say it wasn't to them when they were younger and I was working long hours. It's to our patients. So doing something that will hinder or compromise or disrupt our patients' progress and recovery is something you'd never do on a whim. I think people would have thought long and hard and many times about striking. But my view is, as much as that is a regrettable discomfort, regrettable if thing for patients to go through today if things are cancelled, actually I think that there's a longer term gain, assuming we're successful, of impressing on the government and Health New Zealand just how important this long game is of recruiting and retaining. It may be a slightly off-colour analogy, but I think if you have an operation, you know there's a long-term benefit, you're going to be sore for a day or two, but you know there's a long-term gain. And I see the strikes as being that immediate soreness after an operation. Don't want it, but maybe it's a price it's worth paying.
Yeah, and it's about
I feel that way.
It's about creating a workforce that's sustainable, right? You've got to be able to keep those doctors in work so that they can look after these patients, and this is how we achieve that, hopefully.
Absolutely. Yeah. I mean, just if we've got time, just to come back to your point about fatigue. So, fatigue is part of the wallpaper for doing medicine, nursing, whatever. You have a busy week, you're tired, you come home, you have a nap, on the sofa. But I think what your listeners need to be aware about is beyond that, there's a thing called burnout, where actually you become exhausted and your ability to function at that high level starts to get compromised. And we also are seeing more of a thing called moral injury, where, despite what the minister said, I do have an ethical code, I do have a moral code, and I try to treat my patients with that. But when I can't, for reasons that I can't change because it's resourcing and things, that actually affects me psychologically. That my job, again, is to my patients to make them better, but I'm not given the tools to do the job I know that I can do and I know that they need.
Hey, thank you so much for joining us as part of the Rhema whānau. We really appreciate your company, and if you'd like to check out more stories like that one, just click here.
In fact, our channel has a whole bunch just like this, stories that can encourage you and inspire you and make you more aware of what other people's lives are like in Aotearoa and around the world. So maybe you could subscribe right here.